first session of the HIV Interfaith Conference that is looking at ensuring the provision of HIV services during COVID-19, best practices by faith groups. The purpose of this session is to look at how the COVID-19 pandemic has impacted HIV with a particular focus on the provision of HIV services. We will also be hearing about some best practices from faith communities that provide health and also look to strengthen the integration of research and community engagement among vulnerable communities. In this first part of the session, we will be setting the scene. I will give a very brief overview of the COVID-19 pandemic from WHO's perspective, and then I will be handing over to colleagues Shannon Hader and Katie Godfrey from UNAIDS and PEPFAR respectively for their opening comments and presentations. And so very briefly into my presentation now. May I have the next slide? I think everybody's well aware of the current global situation of COVID, but what we see on this slide is on the left, the 5 countries with the highest cumulative number of cases. So these are the countries that over time, when you add up all the cases, have the highest number. And we see that unfortunately, the United States of America, India, Brazil, the Russian Federation and Peru are suffering a great deal. On the right, unfortunately, we see a similar statistic with the highest cumulative number of deaths due to COVID-19. Next slide, please. In this slide, we can see a brief snapshot of the number of COVID-19 reported cases to WHO in the last 7 days per 1 million of the population. So just in summary, you can see that where the color is a darker orange, that is where there is widespread community transmission. And of course, again, similar picture, Latin America, North America, Europe continues to be undergoing a community transmission, as well as Central and Southern Asia. Next slide. On this more somber slide, it's actually a similar picture. This is to do with the deaths. Again, where the green is a darker color, this is where there are the highest number of deaths reported to WHO in the last 7 days per million population. So again, we see Latin and North America, Central Asia, and Southern Africa as well. Next slide. This slide just gives a little brief overview of the distribution of the COVID-19 cases according to both age and sex. So we can see that the majority, on the left side, the majority of confirmed cases are among people from about the age of 20 to 65. And on the right, we see though that the burden of mortality and severe disease is really among the older age groups. And so what we know and see from all these slides, that really this is an unprecedented global health crisis, but it is not the only global health crisis. It is a health crisis that is overlaying other many protracted crises around the world, not just among infectious diseases, but with gender-based violence and other humanitarian issues and refugee crises. And so COVID-19 is really just exacerbating existing situations and making them a lot worse. And so nobody is not affected by this pandemic. Next slide, please. So WHO that recognizes that religious leaders and faith-based organizations and faith communities have a very significant and unique role to play during the COVID-19 response, not just in terms of supporting local health systems by delivering healthcare and by adapting their faith practices to reduce infection, but also we see from WHO that faith leaders are a trusted source of accurate information. And this is something that we're particularly interested in the group that I work in, which is really about information and trusted information so that people can make decisions that can protect their health. And we see faith leaders having a really critical role to play here among their communities and constituents. We also see that health crises are very disruptive, not just because of the illness that they bring, but because of the uncertainty, the fear, the socioeconomic impacts. And we see that faith communities and faith leaders have a significant role to play in increasing and promoting social cohesion, particularly for the marginalized and vulnerable people. And we know also, and I think everybody is aware of the significant impact on mental health around the world that this pandemic is having. And I think that I don't think we've seen the extent of it yet. And I think that, again, faith communities have a role to play here when it comes to promoting mental health and combating social stigma around COVID-19 and other health issues. Next slide, please. So while WHO's mandate is primarily a technical agency to provide normative products and normative guidance to our ministries of health and national governments, we do partner with a lot of other UN agencies in the context of community engagement and civil society engagement. We have a history of working with faith communities. However, we see, and we have seen through the COVID-19 response, that this work is really of paramount importance. And we are trying to, within the team that I work in, support the ongoing work of religious leaders, faith-based organizations and partners, and the faith communities around the COVID-19 pandemic and beyond. And some of this work and collaboration has been to share best practices and experience. We even co-developed the guidance for faith communities and COVID-19, and we're looking to build trusted networks to, again, share accurate information and to amplify these messages and guidance. We're also looking at joint research questions between faith communities and national health authorities and WHO to see where we can identify what has worked in collaboration at national level to see if we can amplify these best practices. Next slide. So looking forward, what WHO is going to be doing, particularly in the area of health emergencies, which is where I work, is we're going to try and co-develop among the faith community a framework for engaging faith leaders and faith-based organizations around health emergencies. To support this, we will develop a communication strategy that we can roll out. And also we will work to ensure that we have a representative group of faith community and faith leaders with whom we are consulting and engaging with on a regular basis. One very exciting part of this project is that we're trying to build an interactive digital community platform. And what this really means is it's a digital space that can take both can draw on data and information that is available from trusted sources, make it available to different communities with whom we're working, and then enable an element of collaboration within a neutral space that WHO can provide, sharing of best practices and co-developing content for high impact health events. And so we have a lot of exciting projects in the pipeline, and I'm very easy to find at WHO. So if anybody is interested in talking to us more about the work that we're doing or being engaged, please don't hesitate to send me an email and get in touch. And now I'd like to stop there from my side and say thank you to you for listening to me. And we're going to move now more into the main meat of the session. And I'd like to hand over now to Shannon Hader from UNAIDS. Shannon, you have the floor.